Your body has an amazing defense system, a complex network designed to keep you healthy and safe from various threats. A very important part of this system is your lymph nodes, which play a crucial role in maintaining your health. Think of lymph nodes as small, bean-shaped glands, each one working tirelessly to protect you. You have hundreds of them throughout your body, strategically placed to maximize their effectiveness. They are like tiny filters or security checkpoints, constantly on the lookout for potential threats. Their main job is to help your body fight off infections and diseases, acting as a frontline defense. They trap harmful things like bacteria, viruses, and other unwanted invaders, preventing them from spreading. This helps to stop these troublemakers from spreading further and causing more problems for you, ensuring your body stays healthy. These lymph nodes are a key component of your lymphatic system, an essential part of your immune defense. This system is a network of vessels and organs, all working together to keep you healthy. It works alongside your blood circulation system, ensuring that your body functions smoothly. The lymphatic system carries a clear fluid called lymph, which is vital for your immune response. This lymph fluid bathes your body's tissues, providing them with essential nutrients and removing waste. As it circulates, it picks up waste products and, importantly, those unwelcome germs, ensuring they are dealt with. The lymph fluid then travels to the lymph nodes, where it undergoes a crucial cleaning process. Inside the nodes, special white blood cells, which are your body's infection-fighting soldiers, are waiting to spring into action. These cells identify and destroy the harmful substances, effectively cleaning the lymph fluid before it returns to your bloodstream, ensuring it is safe. You might not even notice your lymph nodes when they are doing their job quietly, as they are usually unobtrusive. They are usually quite small, perhaps the size of a pea or a small bean, making them easy to overlook. They are often found in clusters in specific areas, strategically placed for maximum efficiency. These areas include your neck, armpits, groin, chest, and abdomen, where they can best perform their protective roles. When everything is calm and you are healthy, these nodes remain small and soft, quietly doing their job to keep you well. The neck is a particularly important area where many lymph nodes are located. You have chains of these nodes running down the sides and back of your neck. Some are just under your jawline, while others are behind your ears or near your collarbone. Their location in the neck is very strategic. This is because your head and neck are common entry points for germs. Think about it. You breathe in air through your nose and mouth. You eat and drink. Your ears are also open to the environment. The lymph nodes in your neck are therefore constantly on guard. They are specifically responsible for filtering lymph fluid that comes from your scalp, face, mouth, throat, and ears. If you get a sore throat, for example, the lymph nodes closest to your throat will likely be the first to respond. This is why you might feel swollen glands in your neck when you have a cold or a throat infection. The most frequent reason for neck lymph nodes to swell up is an infection. Your body is constantly encountering germs, and when these germs invade, your lymph nodes jump into action. Common viral infections are major culprits. Think about the common cold or the flu. These illnesses caused by viruses often lead to swollen glands in the neck as your immune system battles the viral particles. Similarly, infections like measles, mumps, or rubella, though less common now due to vaccinations, can also cause significant lymph node swelling. Bacterial infections are another very common cause of inflamed neck lymph nodes. Strep throat, for instance, is a bacterial infection of the throat and tonsils. It almost always causes the nearby lymph nodes in the neck to become swollen and tender. Ear infections, which can be caused by either bacteria or viruses, also frequently lead to swollen nodes. While infections are the leading cause, other conditions can also make your neck lymph nodes swell. Sometimes the inflammation isn't directly due to fighting off germs, but is related to other processes in the body. For example, certain autoimmune disorders can cause lymph node enlargement. In these conditions, the body's immune system mistakenly attacks its own healthy tissues. Conditions like lupus or rheumatoid arthritis can sometimes manifest with swollen lymph nodes. Another less common but important group of causes includes certain types of inflammatory conditions that are not infectious. For instance, Kawasaki disease, a rare illness primarily affecting young children, can cause significantly swollen lymph nodes in the neck. Section 5. Recognizing the signs. Symptoms of inflamed neck lymph nodes. The most obvious symptom of inflamed neck lymph nodes is, of course, swelling. This swelling can be quite noticeable and may cause concern. You might notice a lump or a bump in your neck that wasn't there before. This lump can appear suddenly or develop gradually over time. This lump can vary in size. It might start small and grow larger as the inflammation progresses. Sometimes it's as small as a pea, but it can also grow to be the size of a grape or even larger. The size can give an indication of the severity of the inflammation. You might discover it by chance while washing your neck, shaving, or simply by feeling a new prominence. Everyday activities can bring these changes to your attention. Along with the swelling, tenderness, or pain in the affected lymph node is very common. This discomfort can vary in intensity. When you press on the swollen area, it might feel sore or even quite painful. This pain can be a constant reminder of the underlying issue. This tenderness is a sign of active inflammation within the node. The body's immune response is at work, causing this reaction. The degree of pain can vary. It can range from mild discomfort to more severe pain that affects daily activities. For some, it might be a dull ache, while for others it could be a sharper pain. The nature of the pain can provide clues about the underlying cause. Sometimes the skin over the swollen lymph node might also show changes. These changes can be subtle or more pronounced. You could notice some redness in that area. This redness is a sign of increased blood flow to the inflamed region. The skin might also feel warm to the touch compared to the surrounding skin. This warmth is another indicator of the body's inflammatory response. Section 6. Listening to your body. When swelling needs a closer look. Most of the time, swollen lymph nodes in your neck are a temporary response to a common infection and will resolve on their own or with simple treatment for the underlying cause. However, there are situations when swollen lymph nodes warrant a more thorough investigation by a healthcare professional. It's important to listen to your body and be aware of certain red flags. One key factor is how long the swelling lasts. If a lymph node remains swollen for more than 2 to 4 weeks, especially if there's no clear sign of an infection that's getting better, it's wise to get it checked out. Section 7. Finding relief, medical treatments for swollen lymph nodes. When you see your doctor for swollen neck lymph nodes, their first step will be to figure out the underlying cause. The treatment will then be aimed at addressing that specific cause, rather than just the swelling itself. If a bacterial infection, such as strep throat or an infected tooth, is identified as the culprit, your doctor will likely prescribe antibiotics. These medications work by killing the bacteria or stopping them from multiplying, which allows your body to overcome the infection. As the infection clears up, the lymph nodes will gradually return to their normal size, and the tenderness will subside. If a viral infection like the common cold, mononucleosis mono, or the flu is causing the lymph node swelling, antibiotics won't be effective. In these cases, treatment usually focuses on managing the symptoms of the viral illness. Section 8. Comfort measures at home, supporting your body's healing. While medical treatment addresses the underlying cause of swollen lymph nodes, there are several things you can do at home to help manage any discomfort and support your body's healing process. These simple home remedies can complement your medical treatment and provide relief. One simple yet effective remedy is applying a warm compress to the affected area. This can be particularly soothing and can help to alleviate some of the discomfort associated with swollen lymph nodes. You can soak a clean washcloth in warm, not hot water, wring it out, and gently place it over the swollen lymph node in your neck for about 10 to 15 minutes, several times a day. This method is easy to do and can be very effective. The warmth can help to increase blood flow, reduce pain, and soothe the inflammation in the tender area. This increased blood flow can also promote faster healing. Getting plenty of rest is crucial when your body is fighting an infection or dealing with inflammation. Rest allows your body to focus its energy on healing and recovery. Your immune system works best when your body is well rested. Ensuring you get enough sleep each night can make a significant difference in how quickly you recover. Pushing yourself too hard can prolong your illness and potentially make the lymph node swelling last longer. It's important to listen to your body and take breaks when needed. Staying well hydrated is also very important. Hydration helps your body function optimally and supports your immune system. Drinking enough fluids such as water, clear broths, or herbal teas helps to keep your lymphatic system functioning properly. Proper hydration can aid in flushing out toxins and keeping your body in balance. Section 9. Staying vigilant. Prevention and knowing when to see your doctor. While you can't always prevent swollen lymph nodes, as they are a natural response to infection, practicing good hygiene can reduce your risk of getting common infections that cause them. Wash your hands frequently and thoroughly with soap and water, especially before eating, after using the restroom, and after being in public places. Avoid close contact with people who are sick with contagious illnesses like colds or the flu. Also, try not to touch your face, particularly your eyes, nose, and mouth, as this is a common way for germs to enter your body. Maintaining a healthy lifestyle can also support a strong immune system, making it better equipped to fight off infections quickly. This includes eating a balanced diet rich in fruits, vegetables, and whole grains, getting regular physical activity, managing stress effectively, and ensuring you get enough sleep each night. A robust immune system might not prevent every infection, but it can often reduce the severity and duration of illnesses.